So the challenge that we're really facing within the health service in Wales is an increasing demand for the need for delivering outpatient services and a very limited expansion pace of the capacity that we've currently got. And considering the effects of the COVID pandemic, we really need to find new innovations at pace to deliver some of these solutions. And these really focused around enhanced self-management, enhanced communication and support between the healthcare system, doctors, nurses and allied health professions, as well as the patients, but also looking to find new ways of introducing artificial intelligence and other such innovations to help increase the pace at which we incorporate diagnostics, for example, into the whole delivery of the outpatient setting.
IBEX are developers of clinical grade AI for pathology, and we're developing sort of trusted AI technologies to improve patient care. And in particular in this SBRI challenge, we took one of our solutions called IBEX Gale and Prostate, which is an AI technology which analyses the tissue taken from prostate biopsies in men, which would typically be looked at by pathologists on a microscope slide. And in this case, those slides are digitized, creating very high resolution images, and then they are uploaded to the cloud where the AI technology analyzes that tissue to identify the presence of cancer and other clinically relevant features for the diagnosis of the patient.
The key for us is to understand actually what the public sector and the NHS are looking for. And so the clarity that we've been given in terms of outpatients transformation and from the clinical leadership particularly has been invaluable. So for us as an SME, we want to understand what is the innovation that will really make the difference. And in this context of the project we're doing, it's outpatients transformation. And that there's lots of ideas drifting around, and we've got from the outside, we've got a sort of reasonably good idea of, broadly speaking, what kinds of innovations might make a difference. But what's really helped in this SBRI process has been that's been distilled down to a very precise and detailed definition of what could make a real impact on waiting lists, on outpatients, for elective care. That kind of insight is invaluable for us, because then once we understand what the requirements are, then and what the innovation is that could really have an impact, then we can then implement that and test it.